Deutetrabenazine, also known as Austedo XR 24 mg tablet, is used to reduce involuntary movements caused by Huntington's disease and treat involuntary movements of the face, tongue, or other body parts known as tardive dyskinesia. By decreasing the amount of certain natural substances in the brain, such as dopamine, serotonin, and norepinephrine, this medication helps to improve your ability to take part in normal daily activities. The recommended daily dosage and optimal timing for Austedo XR 24 mg tablet should be determined by your doctor based on your specific condition. It is important to follow your doctor's instructions carefully to get the most benefit from this medication. Before starting Austedo XR 24 mg tablet extended-release dopamine-depleting agents, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the tablets whole. Do not crush, chew, or break the tablets. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Use this medication regularly at the same time each day to get the most benefit from it. If you stop taking this medication for more than 1 week, do not take another dose until you talk to your doctor. Tell your doctor if you do not get better or if you get worse. Some common side effects of Austedo XR 24 mg tablet may include drowsiness, trouble sleeping, tiredness, dizziness, nausea, or vomiting. If these effects persist or worsen, inform your doctor or pharmacist promptly. Your doctor may need to adjust your dose to reduce these side effects. To minimize the risk of dizziness and lightheadedness, make sure to rise slowly when getting up from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. Notify your doctor immediately if you experience any serious side effects, such as agitation/restlessness, symptoms of Parkinson's disease, or side effects that resemble the symptoms of worsening Huntington's disease. Deutetrabenazine can sometimes cause side effects similar to the symptoms of worsening Huntington's disease. If you experience any of these serious side effects, including mental/mood changes, trouble swallowing, uncontrolled muscle movements of the face, or signs of increased prolactin hormone, contact your doctor right away. In rare cases, this medication may cause a very serious condition called neuroleptic malignant syndrome, NMS. Seek medical help immediately if you experience symptoms such as fever, muscle stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, dark urine, or signs of kidney problems. While allergic reactions to this drug are rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects. If you experience any other effects not listed here, contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. If you have Huntington's disease, Deutetrabenazine can sometimes increase the risk of depression and suicidal thoughts/attempts. People with Huntington's disease are already more likely to have depression and suicidal thoughts/attempts. Talk with your doctor about the risks and benefits of this medication. People with Huntington's disease and depression must not use Deutetrabenazine if they are not being treated for depression or if they still have symptoms of depression with medication/treatment. Tell your doctor right away if you or your family/caregivers notice that you have new/worsening symptoms of depression, sadness, loss of interest in activities you used to enjoy, suicidal thoughts/attempts, or other mental/mood/behavior changes, such as new/worsening anxiety, panic attacks, trouble sleeping, irritability, hostile/angry feelings. Before taking Austedo XR 24 mg tablet, extended-release dopamine-depleting agents, it's important to consider any allergies or medical history that may affect its use. Be sure to talk to your doctor or pharmacist about any allergies you may have, as well as any medical history, especially if you have had breast cancer, liver problems, or certain heart problems. This medication may cause dizziness or drowsiness, so it's important to be cautious when using it, especially when consuming alcohol or marijuana. Avoid driving or using machinery until you know how this medication affects you. It's also important to talk to your doctor if you are using marijuana. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. It is also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. When taking Austedo XR 24 mg tablet, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Austedo XR 24 mg tablet is valbenazine. Additionally, taking MAO inhibitors with this medication could lead to a serious, possibly fatal, drug interaction. It's important to avoid taking any MAO inhibitors, such as isocarboxazid, linezolid, metaxalone, methylene blue, and others, during treatment with this medication. Most MAO inhibitors should also not be taken for 2 weeks before and after treatment with Austedo XR 24 mg tablet. It's essential to consult your doctor for guidance on when to start or stop taking this medication. Furthermore, it's crucial to note that deutetrabenazine is very similar to tetrabenazine, and medications containing tetrabenazine should not be used while taking deutetrabenazine. It's important to follow your doctor's guidance and recommendations when taking Austedo XR 24 mg tablet to ensure safe and effective treatment. If you believe someone has taken too much Austedo XR 24 mg tablet and is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include muscle stiffness or pain, fixed upward position of the eyeballs, sweating, dizziness, and severe drowsiness. If you suspect an overdose, seek medical help immediately. This medication is for the exclusive use of the person for whom it is prescribed. Do not share this medication with others. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Austedo XR 24 mg tablet at room temperature, away from light and moisture. Make sure to keep the drying agent, desiccant, in the bottle and avoid storing it in the bathroom. It's also essential to keep all medications out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you have any questions about how to dispose of Austedo XR 24 mg tablet, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.